Hi, my name is Jackie Dehnert, and I'm a Liberty University nursing student, and I'm a senior this year, and I'm giving my informative speech on ER nursing. I'd like to thank Sierra, Catherine, and Michaela for coming tonight listening to my speech. So, imagine you are sick, scared, and barely able to breathe. Your family calls 911, and the emergency ambulance rushes you to the emergency department. There I am, ready to take your vitals, give you an EKG, and put some oxygen on. I can comfort your family and tell them that everything looks okay, and we're doing all we can to help you. In a few months, I hope to be an ER nurse. Most people will need to go to the ER either for their own health or for the health of a loved one. I personally have gone to the ER for myself and for my family multiple times. And I'm very lucky this semester to have over 140 clinical hours in the ER. The nursing room is very exciting and fast-paced, a job that requires a lot of hard work and mental toughness, but it's also a job that can be used to glorify the Lord. Today I'll be speaking on the training that's involved in being an ER nurse, what they actually do, and how you can glorify the Lord through being an ER nurse. While being an ER nurse might seem a little bit intimidating, today I'll try to tell you more about it and help you understand what it is a little bit better. The training to be an ER nurse is extensive and time-consuming. First, obviously you need to be a registered nurse, and there's two ways to do that. You can either go through a 2-year associate degree program, or you can go through a 4 years bachelor's degree, which is what I'm doing, and hospitals do prefer a 4-year program. Secondly, you need to be ACLS and BLS trained. ACLS is Advanced Cardiac Life Support, which means that you're able to help people who go into cardiac arrest. And I'm currently learning how to do this, and it's really cool. And PLAS, or PALS, is Pediatric Advanced Life Support, which you're just learning to do the exact same thing, but in the pediatric population. And the third thing that you don't need to have, but hospitals like you to have, is a Certified Emergency Nurse Certification. This is where you learn the detailed things that emergency nurses need to do every day, and you have to take a test and be certified for that as well. So as you can see, the training is pretty extensive, but we use it to better help our patients. Nursing work in the ER is demanding and stressful, but it can also be really rewarding. ER nursing is very exciting because you see a wide range of patients. You never know what's going to walk in through the door, and so you always have to be prepared and on your A game for anything that can come at you. And ER nurses only have 2 to 4 patients. Most nurses on other floors have 6 patients, so it's kind of nice. You have a smaller patient population. And one of my favorite things about ER nursing is that we can give medication orders and testing orders, and most nurses can't do any of that. So we can make the patient comfortable and get them to x-ray or do what they need even before the doctor sees them. So I think that's really nice. And emergency nursing is such an amazing job. It's one that allows the nurse to share the love of Christ as well. The emergency room is a place that uses nurses to share God's love with others. ER nurses have the opportunity to see people at their worst, which really allows us to be able to help them the best. And Romans 15:1 says, "We who are strong have an obligation to bear with the failings of the weak and not to please ourselves." Galatians 6:2 says, "Bear one another's burdens and thus fulfill the law of Christ." Since we are Christians, we have a responsibility to help those who are weaker than us, and we are able to do that so effectively in the nursing in the ERs especially. So even if the ER nurse can't explicitly share the love of Christ, we can do it through the care that we give our patients. Whether it's a hug or a pat on the hand or just a caring word, we can share God's love even if we're not allowed to give them the gospel, for example. Another one of my favorite things about the ER is that people are really open to the gospel because they're scared and they really are in need of comfort, and so nurses can come in and pray with them and give them the gospel. I actually have had patients ask me to pray with them, which is really rare in the hospital. And Galatians 6:9 says, "Let us not become weary in well-doing, for at the proper time we will reap the harvest if we do not give up." the Lord can use anyone who's willing, and an ER nurse is certainly not the exception. So in conclusion, ER nursing is a challenging profession that takes extensive training and hard work. The Lord promises to bless the efforts of those that are willing to do the job to glorify Him. ER nursing is an amazing career that benefits both the patient and the nurse. The Bible says in Hebrews 6:10, "For God is not unjust as to forget your work and the love which you have shown towards His name, and having ministered and still ministering to the saints." So I think the ER is an amazing place to minister to God's people.